It has been said that posture is the window to the spine. Actually, posture is the window to your overall health and performance. We all know what the word posture means, but most think that poor posture is simply a state of not looking your best. But posture is a reflection of the health of the spine. It's the shifting of the spine that can create the outward posture appearance. Many conditions can trace their origins back to poor posture. Tension headaches, neck pain, pain between the shoulders, low back pain, fatigue, lowered resistance can all be symptoms of the effects of poor posture. Many major studies like those published in Spine, the Journal of the American Geriatric Society, the American Journal of Pain Management, and the Archives of Internal Medicine have shown a direct correlation between poor posture and poor health. Please take a moment to review the highlights from some of the most recent studies. By changing a person's center of gravity, poor posture also changes structural loads and creates an instability in the spine and can cause low back pain. In addition to genetic predispositions to poor posture, how we work or play or the loads we carry all can contribute to poor posture. Normal neutral posture has been defined as the head level, shoulders level, hips level, and from the side, a plumb line should pass through the center of the ear, shoulder, hip, and just in front of the ankle. Any deviation from normal will create an imbalance in the body. The most common abnormal posture profile is forward head posture. It's estimated that 90% of the population has a posture profile of the head being in front of the shoulders. This doesn't make it normal, just prevalent. If a person maintains this posture for a long period, months or years, the following can occur. The head moves forward, shoulders become rounded, arms rotate inward, chest cavity compresses, a dowager's hump can develop, and the pelvis will rotate anteriorly. But there is much more to this than not looking your best. The head, about the size and weight of a bowling ball, rests atop a movable support column, the cervical spine, also known as the neck. In this normal position, no additional external forces are transmitted to the spine, muscles, or ligaments. But when the head moves forward in front of the shoulder, additional lever and compressive forces are transferred to the cervical spine and muscles. Gravity now wants to pull the head down to the ground. This force of nature is resisted by the muscles attached to the head and neck. It's estimated that for every 1 inch the head moves forward, an additional 15 to 30 pounds of tension is placed on the cervical muscles. There are certain areas of the spine that carry greater loads and are therefore under greater stress: the cervical spine, mid-back, and low back. The relentless pull of gravity, in addition to stress from work and play, will continue to pull down on the head. This can cause the spine to further distort in an effort to reposition the center of gravity, causing more spinal stress. Some areas of the spine may move too much and some areas too little. Either situation is not good. If you have chronic poor posture, it's best you have your spine evaluated by a trained healthcare professional. Over time, this extra stress can begin to break down spinal discs and cause joint instability. This can lead to a condition known as degenerative joint disease of the spine. Watch the picture on the right as the area of the lumbar spine degenerates. Next can come pain, loss of movement, and nerve damage. While the video makes it look like these changes happen rapidly, in fact they happen very gradually over a period of years. In fact, by the time you notice symptoms, it may be too late to reverse the changes. And did you notice something else? As these posture changes happen, you actually get shorter. Loss of height is a serious condition that can be prevented. It's not just the spine that's affected. All the other joints and muscles directly and indirectly connected to the spine are either under additional preload tension or not enough tension. Either situation creates muscles and joints that become weak and inefficient. Muscles can become weak when held in a shortened state. This can happen due to prolonged poor posture. These are some of the muscles affected by short weakness. And some muscles that are stretched and held in that position for prolonged periods develop a stretch weakness. The following are some of the muscles affected by stretch weakness. Predictable changes happen with forward head posture. The upper back drifts backward and the shoulders rotate inward. Look at the hand position on the pictures. And the pelvis will always tilt forward. The body now has to expend more energy in an effort to stand upright. Even the finest machine will break down if put under abnormal stress. Muscles and joints preloaded due to poor posture will fatigue faster, take longer to recover, and are more prone to injury. Poor posture can affect the following joints, causing pain and poor movement. It can also lead to diminished joint range of motion, arthritic changes, and additional stress on spinal discs. No matter how you work or play, posture affects your overall performance. Proper posture can mean the difference between winning and losing, injury, or peak performance. What's the bad news? Poor posture is not self-correcting. It will only get worse. But there is good news. Poor posture is easily identified and can be corrected. The use of high-tech analysis systems can detect small posture deviations. Finding poor posture early means a greater chance of correction. Abnormal posture does not have to be a lifetime curse. A professional trained in the performance posture system of correction can help you turn back time and may actually reverse physiological changes. You will look better, feel better, and project a more powerful image to the world. This concludes our presentation. Thank you for your time.